9:30 वाग्या.
नमस्ते.
हाँ
Yeah, right. ક્યારે આવ્યા?
Last Monday.
અચ્છા,
5-6 દિવસ થયા.
ઓકે.
હા.
Yeah.
એમાં નથી આવતું.
ખબર નહીં કે some problem.
Okay, so here we go. We are live on the YouTube. Good morning and welcome to Saturday Club morning meeting. Today we have Dr. Nandini Sarvade. She is a consultant physiotherapist currently in Hyderabad. She has done her master's in physical therapy in New York University, USA. And she did her postgraduate diploma in rehabilitation at AIIMS, All India Institute of Physical Medicine and Rehabilitation, Mumbai. She has done her bachelor's in physiotherapy at the School of Physiotherapy, MLC Institute, Baroda. And she had worked in USA for more than 20 years. And in fact, she is not new to Saturday Club of Baroda because 1.5 years back, she did give a talk on quantum reflex integration, which was a new concept for all of us to learn. And again, today we are going to listen to her talking about primitive reflex integration in autism and related disorders. So welcome back, Dr. Nandini. Over to you for next 40-45 minutes, and we'll have about 10 minutes of discussion. Over to you.
Thank you, Dr. Pandian. Yes, thank you so much for inviting me. I'm very happy to be here. I will share my screen now. Can you see it?
Yes, well said.
Okay, very good. Okay, so I'm very happy to be here and talk about primitive reflex integration using low-level laser therapy. Here we... Okay.
Yes.
So this is what I'm going to talk about today. Why reflex integration therapy? I'm really very passionate about this therapy, and I want to spread the word and let everyone know that there is something really good here that is helping our kids, neurodiverse kids with diagnosis of autism, ADHD, and other related disorders. It is very effective, very efficient, and that is why I want to spread the word. Next, I will also talk about what are primitive reflexes. What happens when primitive reflexes are not integrated but stay active? What is low-level laser therapy? Then effectiveness of low-level laser therapy for treating autism spectrum disorder. And I will share some case studies with you also. So why primitive reflex integration? This is I have a master's in physical therapy with a specialization in developmental disabilities. So I have learned a lot of traditional physiotherapy methods for this. I have also done many of continuing education training for this. And I have listed some over here. I did Wilbarger brushing protocol for sensory defensiveness to help that. I have also studied sensory integration therapy, brain gym, craniosacral therapy, myofascial release. I'm also certified as the teacher of yoga for special children. And I have studied Mazgutova neurosensory motor reflex integration. So Svetlana Mazgutova is a Russian psychologist who has come up with a program of exercises to do reflex integration for our kids. So I have done with this exercises and all these other methods, what I saw that it takes a very long, and even then after years, 2-3 years of doing this also, you don't get the results that I see with this primitive reflex integration using laser therapy. This is so much quicker and faster than all these other therapies. Also, this method is very easy to do on the children. These kids who already have difficulty following direction, listening to you and doing the movements like you want them to do, they're already having difficulties with that. So in this method, all you have to do is have the child either lie down or sit in a chair, and you do the therapy on the child. And it is such a relaxing therapy that many of my patients fall asleep during therapy, and they feel so relaxed and very calm. And the reflex integration starts happening right from the first session, and it continues to the different sessions further ahead. And even after we stop therapy, integration continues and they develop and progress normally. So it's a very, very wonderful therapy. And I want to let everybody know that there is something like this. Like I have seen parents with children with autism or ADHD, like they have been doing all these other therapies, OT, speech, ABA, everything for years, and they don't see any improvement in their children. They feel so hopeless and they don't know what to do any more than what they have been doing so far. And so the patients that I have worked with have been all who have like used up all their other therapies and they have nothing else. And this therapy has helped all of my patients that I worked with. It has helped them. Depending on the child, every child is different. So how much progress they make is different for each child, but each patient has made progress. So I feel very, very strongly about this method, and I want to tell everybody about it. Now, about this primitive reflexes, when they are retained, they influence every aspect of our life, the quality of our life. And the children, because they are suffering, their parents, their families, they all get affected. But when reflex integration happens in all the different reflexes that they have, it opens the door to new possibilities and provides hope for our children to reach their potential, which is such a wonderful thing. So what are primitive reflexes? This being a group of doctors, I know we all know that primitive reflexes are automatic involuntary reactions in response to stimuli like touch, sound, movement, even light. So it is an involuntary response to a stimuli or a stimulus. The function in the beginning, just after birth, for the newborn is the primitive reflexes provide them survival and protection until the child is able to do everything voluntarily. So with the reflexes, there is movement that they are able to do without really thinking about it. And if they feel that there is some danger, they will cry out and let parents know that something is happening here. The rooting reflex and the sucking reflex helps them to find nutrition, and they can thrive that way. And also the primitive reflexes help with the development of higher brain centers that control muscle tone, movement, sensory integration, even cognition and learning skills depend on how the primitive reflexes and when they were integrated. So primitive reflexes, like there are quite a few, and each reflex appears, many of them appear at birth. Then their development goes, like it increases, they peak at a certain time, and after that they start getting integrated, so they start fading off and we don't see it anymore. So each reflex has its different timeline that it appears, helps the child, and then it gets integrated, and then the voluntary actions come. There are postural reactions that develop, and so on and so forth. I will show you that later. Just wanted to say that what does integration mean? So it represents a completed neurological connection that works with the nervous system, and then they fold back into the system And these reflexes are there, like waiting on the stage on the sides, in case there is some emergency and you need a quick response, then they are there. But otherwise they don't act later. As after the integration, they are not there. But when the reflex is unintegrated, what happens is that there is a weak or incomplete connection, so that the sensory receptors which get the stimuli, and then so that goes to the brainstem, and they immediately act from there, and the motor neurons would be giving them the reaction. Okay, so this way the reflex will keep on acting constantly whenever the stimulus is there. For any particular reflex that is not integrated, it will keep on acting, and this is coming from the brainstem level, and so the information that is coming does not even reach to our prefrontal lobes for us to think about it, and it all happens very reflexly. And that's how these kids who have all these diagnoses because of their unintegrated primitive reflexes, they are not thinking when they act or react to the stimulus. Moro reflex. I will just talk about a few reflexes. So Moro reflex usually integrates 3 to 4 months after birth. For some kids, it might even integrate at 6 months, but that is it. It appears at birth, and then it continues and it goes away. The stimuli that will bring a response in the Moro reflex are light, sudden light in a dark room, or touch, sound, sudden sound, even taste, smell, or sudden change in body position will bring the Moro reflex. So the Moro reflex usually is seen as the arching of the back and flinging back the arms. That is part one. Part two is that the child almost gives himself a hug like this and clings to mom or dad, whoever is there. And sometimes they might cry after that. So that is the Moro reflex that we see. So that is our early fight or flight response that the newborn babies have. Until a few months after birth, it continues. So when this reflex does not get integrated on time, what we see as children who have difficulty staying asleep, the slightest sound will wake them up and it will like really startle them. They will have very immature eye movements. They will have difficulty catching a ball that is thrown at them. If the ball is thrown at them, they will, instead of trying to catch it, they will close their eyes and try to protect themselves because they cannot, because of the visual problem, they cannot look at the ball that is coming. In school, they will have difficulty focusing on details or copying from the blackboard, like looking at the blackboard and writing down. They cannot do because of the Moro reflex, which is hindering their learning and school work all the time. They have vestibular challenges, poor balance and coordination. These are the kids, if you take them to the amusement park rides, they don't want to go on the roller coaster at all because it is not a good experience for them. As adults with Moro reflex being intact, they live in constant stress because they are in a fight or flight condition. So whenever there is a stimulus that elicits the reflex, they will have the fight or flight response. Some of the diagnoses that we see who have the Moro reflex intact are ADHD, autism, central auditory processing disorders, dyspraxia, visual processing disorders, sensory processing disorders, anxiety, and mood swings. The next one is fear paralysis reflex. This is a reflex which appears at 5 to 7 weeks in utero, and it integrates also at 12 weeks in utero. So from fear paralysis reflex, we get the Moro reflex. And this is the first reflex to appear. But if this fear paralysis reflex does not get integrated before birth, then the baby will have hypotonic muscle tone, very flabby muscles, shallow breathing, hypersensitivity to touch, light, sound, smell, taste, and behavior and the emotional stability that we see in them is a frozen state or delayed response. It is also called as deer in the headlights, so that if you ask them something, they will just freeze. They will not be able to answer you. They have difficulty making eye contact. They dislike change. They have a low stress tolerance, avoidance of confrontation, eating disorders, fear of separation, and you will see expressive language disorder also in this reflex when it is not integrated. So the child who has the fear paralysis reflex not integrated and the Moro reflex not integrated will have a lot of difficulties like this. Autism, OCD, ADHD, or selective mutism usually have the fear paralysis reflex active, not integrated. So selective mutism, I have seen sometimes when the child can speak, is verbal, can talk at home, but when he is outside in a different situation, in the school or with strangers, won't talk at all. But when you integrate the fear paralysis reflex, changes start happening and they get out of the selective mutism. Here is a reflex timeline of a few of the reflexes. So we see here Moro reflex. It starts at 3 months after conception. It is present at birth and it is integrated by 4 months or so of life. The asymmetric tonic neck reflex, ATNR, also appears in utero and it gets integrated by 6 months of age. Then we have the rooting reflex, which gets integrated by 4 months. The spinal galant reflex gets integrated by 9 months. And the tonic labyrinthine reflex takes a long time to integrate. It's like 3.5 years. And the symmetric tonic neck reflex appears at 6 months of age and gets integrated by 9 months. And the Landau reflex here, 3 months of age it appears and it gets integrated later also by almost 3 years of age. Here you have a small graph to show you that the primitive reflexes, when they appear at birth, this is like they stay active. This is like for a group of reflexes. They stay active until 3 months and then they start getting integrated. And as the nervous system matures and as the voluntary control takes over, they start getting integrated. And the postural reactions, which are going to stay with us for life and are going to help us do good balance reactions or walking, running, everything, they start appearing at births and then slowly they take over and they are here and the primitive reflexes are integrated. And here we have a few reflexes which will show what happens when they are retained. So the Moro reflex, like we said earlier, their purpose is like a primitive fight or flight reaction. When they are retained, we see hypersensitivity, hyperreactivity, poor impulse control. You see kids who will just run into the street without any fear or care. So they are the ones whose Moro reflex is not integrated. There is sensory overload, social and emotional immaturity. A rooting reflex, when it is not integrated, it shows fussy eating, thumb sucking, saliva dribbling, speech and articulation problems. Then for the palmar reflex, which is the automatic flexing of fingers to grab when the little babies catch the finger and won't let go, that one. That one should be integrated by 6 months. And if it is not integrated, then there is difficulty with fine motor skills, poor manual dexterity, and messy handwriting. The ATNR, asymmetric tonic neck reflex, that is one of the very important reflexes for learning in school. Its primary purpose was to assist the baby through the birth canal and also to help develop cross pattern movements. And it should be integrated by 6 months. But when it is not integrated, we see poor eye-hand coordination, difficulty with handwriting, trouble crossing the vertical midline, poor visual tracking for reading and writing. So the ATNR is usually seen when the head turns. If it turns to the right, then the left hand comes in flexion, left leg comes in flexion, and the right arm and leg goes in extension. When the head turns left, it is the opposite. So if it is active, then when the child is trying to read or trying to write, any neck movement is going to bother him. The next one is spinal Galant reflex. It also assists the baby with birth process, and it should be integrated by 3 to 9 months. When it is not integrated, we see a very fidgety child who cannot sit and has to keep on walking or keep on moving all the time. Sometimes you see bedwetting, poor concentration, poor short-term memory. And the TLR, or tonic labyrinthine reflex, which has the purpose for head management and postural stability using our major muscle groups. It should be integrated by 3 to 3.5 years, but when it is not, we see toe walking, tendency to walk on toes. Many of our kids who have autism, we see them walking on their toes. When we ask them to put their heel down, they can do it. Voluntarily, they can put it down. But once they start walking and they're not thinking about it, up they go on their toes. They will have poor balance. You see motion sickness, and they have difficulty with orientation in space. Next one, Landau reflex, which also assists with posture development. And when it is not integrated, we see poor motor development, gross motor, and everything, running around, riding the bicycle. Or STNR, symmetric tonic neck reflex, that stays for a very short time, but it prepares the child for crawling. And if it does not get integrated by the time schedule that it should be, then you would see a tendency to slump while sitting. You have poor muscle tone, poor eye-hand coordination, inability again to sit still and concentrate. So hyperactivity is so much present. So many of these reflexes, and you will see there are even more, have many overlapping symptoms that we see. So as the reflexes start integrating, the symptoms start disappearing. So these are the reflexes that I work on during a therapy session. So we start chronologically, like Moro reflex is the first one, then fear paralysis, spinal Galant, Babinski reflex, and all of these, I go in this order. Then after Babkin, palmomental, I would do frontal release, hands grasping, and all these. So what happens here is that if the Moro reflex is not integrated well, then the next reflex is not integrated. The one after that is not integrated. So like just to give you an example, something like it is a pileup on the highway. So if the first one is not doing well, then the next one gets affected, the one after that gets affected, and you have a big chaos, a big traffic jam, something like that. But when we work on the Moro reflex and all the other reflexes, as the reflexes start integrating, the first one will help the second one helps the third one, and it is a chain reaction. So it is very good to see how the integration starts happening and the child starts improving and developing wherever it was stuck in. Like when the reflex is not integrated in their development. all the therapies that are out there right now, they usually help the child to function from where he is. The core problem that is there is not helped really. So that is why, again, this therapy for reflex integration with laser helps them to start integrating very fast and develop fast. And we know our kids don't have too much time. They have to catch up to their peers. They have to develop. They have to learn so much to have a good quality of life and to reach their full potential. Some of the causes of unintegrated reflexes. In children, emotional and mental stress of mother during pregnancy is important because this stress usually does not allow the fear paralysis reflex to get integrated. And that's how children are born with the fear paralysis reflex intact, and with that, the Moro reflex and everything else. Also, traumatic birth events will affect the integration of reflexes. Insufficient activity and insufficient natural movements also do that. Many parents love to get their children new equipment, so they buy them baby walkers and their swings at home, baby seats. They all look fancy, but they are not helping the children at all because they are restricting the normal movements. Kids are not able to roll and crawl, and as much as needed, they don't do. So like transition from crawling to standing, they are not able to practice if they are put in baby walkers. So their reflexes don't get integrated well, not completely, and then they have other difficulties. We also see unintegrated reflexes in genetic abnormalities like Down syndrome and other syndromes that have that problem. This is with adults, like just on the side, that we see unintegrated reflexes in adults who earlier might have integrated their reflexes very well and are fully functioning adults in society. But for them also, if they are under too much stress, if they have falls, because when you are falling, only your primitive reflexes come out and save you. So falls, then emotional trauma, physical trauma, traumatic brain injuries will of course affect the reflexes. Surgeries undergoing that the body goes through, even at that time, primitive reflexes get unintegrated because our conscious mind knows that, okay, this is surgery is safe for me, it is for my own good and everything. But at the core level, the reflexes feel that, oh, this is something dangerous, and they get unintegrated. And last but not the least, toxins that we all face in this world today, in the environment, food, water, air, everywhere, they also play a big part in getting our reflexes unintegrated for adults. Now, the equipment that I use, it has got class 1 laser, so it is very safe. It is called cold laser, and it is called cold laser because there is no heat produced. Okay. There are red lasers, violet lasers, and infrared lasers in the handheld devices that I use. The red laser benefits tissue regeneration, inflammation, and has analgesic effect. The violet lasers help to develop brain dominance, reduce aging of the skin, and increase ATP at the cellular level. The infrared lasers go deepest in the body. They also influence the bone strength, and they are used many times on the head for brain injuries. And there are a lot of studies and clinical trials that have been done for all this. And in my reference section, I have put quite a few of them. So if anyone wants, I will be happy to send you share the PDF of that. In this equipment, there is also a frequency sweep generator, which is a machine that produces sound waves and harmonically sweeps through multiple frequencies. So this is like sound coming from a full scale piano, and right from the end, very low sound to the very high sound. That is how the frequencies go through. And this is very therapeutic, and it helps with the reflex integration. The third thing that is used in this method is reflex integration patterns. So for each and every reflex, there are different patterns where we put the laser and hold it for a specific time. We are putting them on different acupoints. And I looked up research material to see how putting a reflex here is going to help your frontal or temporal or wherever. How is it going to help the brain? So I found some studies where they had done putting laser on a acupuncture point, which was for a specific part of the brain. So they did functional MRI studies, and they saw that when they were putting the laser on the acupuncture point, which was for a specific brain area, that part of the brain lighted up. But when they would put the laser on another point, which had nothing to do with any acupuncture point, nothing happened. So that helped me to understand how this works. Here is a picture to show mechanism of action of a low-level laser at a cellular level. So this shows the infrared light. When it falls, the mitochondria absorbs the photons, and that activates the signaling pathways to do different things, increase ATP and increase cell growth and all healing, all good healing. So here are again some beneficial effects of low-level laser. ATP production, inflammation, digestion, immune system is helped, nervous system repair is seen. I have seen very good results with neuropathies also in adults. Wound healing and depression, anxiety, all of these, I have some studies showing that this was how effective it was in, again, my reference section. I just want to tell you about a few of my patients. I worked with a 4.5-year-old boy with autism spectrum disorder, ADHD. He had also symptoms of toe walking. His handwriting was terrible. And he also had speech. He had a lisp. He was not very clear in speaking. And after the treatment, his toe walking went away totally. He was walking like normal gait. His handwriting improved. His mom sent me many videos showing how he's like dancing and talking so clearly, and his handwriting had improved. So that was wonderful to see. And I worked with a 5-year-old girl, also with ASD and ADHD. And her visual stimming was very peculiar. Like she would look to the right corner very much, and then she would look to the left. She would not look straight ahead at you. Her eye contact was poor. And she did not interact with her sister or her family at all. She had a very loving family and an older sister who wanted to play with her and talk with her, but she wanted nothing to do with that. She would be alone by herself. But after the reflex integration therapy, like after every session, her mom started seeing improvements, and she would send me messages and she would send me videos showing how the little girl was changing right in front of my eyes. Like she started playing with her sister and singing. Her dad used to play the guitar, so she started singing like Bollywood songs with him, and the family would sit and talk, and she started learning very well. She started role playing, which is very difficult for our kids with autism. So they were all very happy. And like these are families from the US, and they keep on calling me like, when are you coming back? So, but right now I don't really have any plans, but just there is a 6-year-old boy that I worked with. He had ASD, hyperactivity, and dyslexia. his teacher used to complain to the mom that he does not sit in his chair. He would keep on moving in the classroom. He could not read. His mom had put him in a Tai Chi martial arts class, and she had one-on-one lessons with the teacher for him, since he could not pay attention in a group setting. But even that was difficult. He could not work even with the teacher one-on-one. But as his reflexes started getting integrated, again, like after every session, she would see improvements. And the teacher put him in a group class because he was doing so well. And after 6 months, I called up the mom and she said that he was reading very well now. So that he loved reading. Like earlier, because of his dyslexia, he could not read. And then when he started reading, he loved reading so much that she said that he cannot put a book down. Like he loves reading so much. And he got very good at sports, which was not earlier at all. He started making friends. He was able to, in sports also, he started doing well because he was able to follow directions of the coach and learn new skills. And this mom was so happy with the therapy. She started sending more and more like of her friends, children to me so that they could also get help. Then I worked with an 8-year-old boy with autism. Very sadly, he had gotten 3 stem cell therapies in his short 8-year age, and one in Mexico, one in Panama, and one in India. But the mom told me that after every therapy, like they didn't see any improvement, but sometimes he would even go backwards. And he was so fearful. He had a lot of anxiety that even before she came and to me, before she brought him, she wanted me to send my photos so that he would know what to expect. Send like a video of the therapy that I was going to do with him, and keep the room very well lighted because he was very scared of any darkness anywhere. So, and he had sleep issues. She said that he had never slept for more than 3 hours in the night. He had difficulty staying asleep. And for this little boy, just after the first session, like the parents came to me on a weekend. And then during the week, the mom sent me a message saying that he slept the whole night. And she was so happy, like he started sleeping very well. His sleeping difficulty went away, and his anxiety started decreasing. And slowly, like earlier, he would not even lie down on my therapy table because his mom said that all the stem cell therapies that he had were on such a table, and he had a very bad memory of the table. So he would not even touch the table. Sitting on the table was out of question. He would scream if we tried to put him there. So most of his earlier sessions, I did sitting on the sofa or a chair with his mom on one side and me on the other side. And we did all the reflex integration with him. And slowly, like by the 7th session, he went and touched the therapy table. Then he sat on it and jumped down. And then when he came for the 8th session, he just climbed on the table and lay down, that he wanted the therapy on the table. So it is like even every child that I work with, I get such good different responses depending on which reflexes that are not integrated, and they start integrating. Then here in India, I worked with a 10-year-old boy who had developmental delay. And when he came to me, his parents had to hold him on both the sides so that he could walk, supported walking, and his balance was very poor. But just after the first session, when he went home, and then he had to have a haircut because when he came, he really had like long hair. So his mom told me when they came next that was the first time that he did not fight when he was getting a haircut. He was fine, totally fine getting the haircut. And she was so impressed that how it made such a difference. And after like a few sessions, and when he started improving, his physician gave me a call. The mom told me that my doctor wants to speak with you. And then I spoke with her, and she also told me that she was so impressed with the and progress that she saw in this little boy. And she said, yes, please continue your therapy, whatever you're doing, because in so many years, he has not shown me any of these improvements. So it's working. So just wanted to share a few with you. Drawbacks of unintegrated reflexes is different diagnoses that we start getting. I have to rush through this because of the time now. This is a little study that I did with 5 children to show the effectiveness of low-level laser therapy, because I could see all this improvement in my patients, but I wanted to see if it was statistically significant at all. So in this study, I had 5 children with ASD diagnosis, and they were treated with 10 sessions of laser. Before the therapy, I have a parent questionnaire of 152 symptoms that I had the parent fill out. And then we have developed a software for this to calculate the integration levels for each reflex according to the symptoms that are present. And after the 10 sessions, I had the parents again fill out the same questionnaire, and then we compared it, and each reflex showed improvement percentage-wise. But the Moro reflex and the fear paralysis reflex, which are the 2 most important reflexes which we want to integrate to help the other reflexes to get integrated. So these are the 2 reflexes that showed really good statistically significant improvements. So for the Moro reflex, the p-value in the student's t-test was less than 0.05. And in the fear paralysis reflex, the p-value was less than 0.01. So that was so good to see. I know this is a very small number of students, of children, but we need to do with a study with more students, more children, and we'll do that in the future. That is for the future. Here is just another study that was done to show how low-level laser therapy had helped in autism spectrum disorder. So they had 40 kids from 5 to 17 years, and they used the aberrant behavior checklist for that in 4 different areas. So the 21 kids who got the laser treatment, we can see the line that all their symptoms started disappearing and they went down everywhere. And the placebo, who got the placebo treatment, they stayed at the same level almost. So they got 8 sessions. So they did, and their check was at before therapy, at 2 weeks, at 4 weeks, and at 8 weeks. They stopped at 4 weeks, and even in the other next 4 weeks, the improvement continued of the symptoms going down. So that is what I see in my in this therapy, that even after we stop the integration therapy, the integration continues. The reflexes are getting integrated, and the children are getting more and more improved. So the kids, like I worked with somebody in Pune. So even here I get, in Hyderabad, I get kids coming from Pune. I just had a family coming from Lucknow who came here, stayed for a week, got therapy every day, and they went back. So even after we stop, because the integration continues of the reflexes, progress continues. And like after 6 months, when I saw one kid in Pune whose mom was now thinking of getting a shadow teacher because he was doing so badly in school. After 6 months, she talked to me and she said that he's doing very well in the regular school. He does not need, and she did not even hire the shadow teacher. And he was progressing very well. His teachers were very happy with him. Okay, now I think if there are any questions, we can answer that.
We'll take up questions. Thank you so much, Dr. Nandini. It was wonderful and simply, amazing, I would say, awesome results you have shown in your patients. Can you please stop the screen sharing?
Yeah.
We can have open session now.
Yes. Okay.
Yeah. So to start with, being a pediatrician, I have a lot of questions myself, and then we'll take up more questions from the other people around. So it seems that the results are amazing. Has it become a part of a standard of care in autism and other disorders that you say it?
Sadly, not many people know about it. That is why I want to spread the word. I want to train other people if anyone wants to study this, and because it is going to help so many different diagnoses, autism definitely, but other developmental disorders and everything, it is helping everybody, all the different. So yes, it is very effective. But even like in India, I don't know anyone else who is doing this.
So I am
And
asking the reason why is it. I mean, you showed some references also. So there is a published literature also on this therapy. So why has it not taken off so well? Because as you very rightly said, these parents of such developmental disorder children, they move from pillar to post, and we as pediatricians feel very helpless sometimes that we are not able to do the best for them. So in such a scenario, why this therapy, which is so effective as per your description, why has it not taken off so well? Is it costly? Are there any issues in the selection of the patients, or are there any side effects or something like?
Oh, no, there are no side effects because cold laser has a lot of physiological benefits, and there are no known side effects at all from the different studies that I have looked at. But yes, it could be, there needs to be more clinical trials and research done, but there is no money to fund that. Since I think also like there is no pharmaceutical company who will help financially for clinical trials or anything. So there is nothing. That is just like a few, like in the US also, there are a few practitioners, not too many, and they are doing all that they can. But yeah, there is not much clinical trial, and not many people know about this.
Is it a costly therapy? How much does it?
Right. So it might be a little costly. So I don't know how much speech therapists and OT costs here, but for this therapy, it is like 5,000 for a session of hour and a half. But the thing is that this therapy is much shorter than say any other like ABA therapy or anything. ABA therapy, like people do for years. And all that they get is, they don't like what they get for that money in this therapy is much, much more than what they would get with the.
So will you recommend this therapy as an adjunct to the other therapies, or you would totally depend on this laser therapy?
I would not say no for others. They can continue with the others, but in the other therapies, the kids will make huge progress very fast. So it would be definitely helpful. But some of my parents, the parents of my kid, the patients, have actually stopped other therapies because they see that their kids are developing so well that just with the regular school and playing outdoors and playing games and things like that is helping them. But that is totally up to the parents. But I will not discourage them from going for speech and other therapies. But I feel that ABA is not required once the reflexes start getting integrated, because eye contact and following directions, all that is taken care of. The child starts doing it by himself.
So for any therapy, we usually look at the efficacy of that therapy in terms of percentage of success. So you showed us all the successful stories, but what is the percentage? Like, you must be getting some patients who may not be responding to this therapy. Is it so?
There is all of the patients that I have worked with. I have worked with about 80 patients so far, and kids and adults are other, like the 30-40 adults I have worked with. Everyone shows some improvement. There is no patient who does not show any improvement. So I feel very strongly that this is such a good therapy for everybody. And there are always good results coming out of that. It is very calming, very relaxing, and the children start developing normally. Their progress, like wherever they were stuck because of the retained reflex, that block is removed, and like some child who is not able to give eye contact starts looking easily at others. they start, when the mom or the teacher calls them, they look at them. Otherwise, earlier, they don't even, you call them, they won't look at you. And
Right.
with the therapy, they are able to look at you, they are able to follow directions, and it keeps on getting better and better as the different reflexes start integrating more and more, percentage-wise. The improvement and the progress that happens, the skills that they start developing, it helps them, and it is like a permanent thing. There is nothing like you take this pill today, and if you don't take it tomorrow, it's not helping. No, this is
No
because this is
regression.
the integration. Huh?
There is no regression to the progress. Whatever progress has been made will be there,
Yes.
will remain
Will
there.
be- Exactly, and it will
So
improve more.
is it the, Dr. Nandini, is it the machine which is costly, or is it the expertise one
Yeah.
develops?
Yeah, it is both. The machine is also very expensive, and the training that you have to go through in the US, you have to go and get trained, that is expensive. And the effort that the therapist has to put in, because here the child does not do anything other than just sit or lie down, just accepting the therapy. But I have to be standing all the time, working on each reflex. This is not just putting something on the head and you leave them there. It is not like that. Every reflex you have to work on the arms, legs, everywhere. So yes, it is the expertise and the equipment both.
Right, right. So which institute you got trained in this?
So this
Therapy.
is not in an institute, but it is a company that makes the equipment.
Oh.
They run classes. It's in Florida. But she
Okay.
also goes to teach all over the country. It is the QRI that I talked about some time ago here.
Right, quantum reflex
Quantum
integration.
reflex integration, yes. So they
Right.
have their headquarters in Florida, but they do teach all over US also in a few centers. Again, like there are not too many people who know about it. And I think even this company, it's a small company, they don't advertise it too much. So not many people know about it. Even in the US, other therapists don't know. Like the parents who come to me, they say, oh, I talked to my OT, she has never heard of it. The PT doesn't know, which is true. But it is very safe. And it gives a lot of benefits also. So there are many side benefits, like we said, like the ATP production improves, then the skin improves. And in the Moro reflex, what happens is because the Moro reflex is in the fight or flight all the time, the kid has this cortisol and adrenaline flowing all the time. And then their immunity goes down and they get sick a lot. You see a lot of ear infections and any other infection that is floating around in the daycare center or school, they catch it. But when the Moro reflex starts getting integrated, the moms of my parents, they say that, oh, he does not get sick so often anymore. And so like health improves and there is a lot of benefit with this reflex integration.
Right.
So
maybe when you come to Baroda, no, we will definitely take your services.
Definitely. Thank you. Yes.
So are there any other questions or comments from other participants? I don't think there are any more questions. So thank you, Dr. Nandini. It was wonderful. The first time you spoke about quantum, it was also a very, very sort of informative and enlightening kind of talk for us. Today, as a pediatrician, I feel very happy to know about this technique, and maybe in future, let us see how we can coordinate these efforts further in India. So thank you very much for being with us. Thank you, and thank you all for joining. We end the session here. Thank you.
Thank you for having me here.